in Botanical Medicine to physicians and practitioners who want to learn about the pharmacology, therapeutics, and safety issues around the planet's oldest medicines. The Botanical Medicine Fellowship will offer CME credits with a dual emphasis between the evidence-based and clinical experience of seasoned practitioners. The modules will be presented in an intensive format focusing on neurology, cardiology, metabolism, infectious disease, and restorative medicine that will provide you with an expanded therapeutic toolbox for the most commonly seen conditions by practitioners in today's clinical settings. Also covered will be the mechanisms of action, therapeutic expectations, drug interaction potential, and traditional uses, as well as the most commonly used herbs in the market. If you have grown weary about hearing about the newest herb on the market is going to cure all diseases, or grown tired of hearing about how every herb is potentially going to derail pharmaceutical dosing or efficacy, this program offers in-depth understanding of botanical medicines from an evidence-based perspective, as well as clinical experience. Botanical medicines, when used properly, have the potential of positively impacting clinical outcomes and improving standard of care with less adverse events. Today we have our chairperson of the Fellowship in Botanical Medicine, Dr. Kevin Spelman, here to answer questions about botanical medicine and highlight the upcoming course, Botanical Medicines in Pediatrics. Thank you so much for being with us today, Dr. Spelman.
Well, certainly. Thank you, Lindsay, for having me.
Great. I wanted to jump right in with why would a physician want to enroll in this fellowship?
Well, in short, botanicals can be, actually when properly used, that is, a very safe and gentle addition to a toolbox. And the evidence base is growing rapidly on this. So what we're seeing now is not just hearsay and anecdotal stories, but we're actually seeing a nice body of literature developing showing the efficacy.
Thank you so much. Why are botanical medicines an important addition to clinical practice?
Well, if you look at what's going on in this country, and actually in Europe as well, visits to complementary alternative medicine practitioners are currently outnumbering visits to medical doctors. And so people are really reaching for something different, something besides pharmaceuticals. Part of that is the soft tech approach, I think, that complementary alternative medicine practitioners offer. But I think part of it, too, is due to the safety issues. Currently, if you look at the statistics, what we're seeing is that about 100,000 people every year die from properly prescribed pharmaceuticals. And that makes basically our primary toolbox in clinical medicine, pharmaceuticals, it makes them one of the biggest killers in the top 10 in the nation for one of the biggest killers. So people are really, I think, wanting something different, they're wanting something safer, and obviously they're wanting something that's efficacious. Currently we have about a third of the population of the United States already using herbal medicines. And so people are using them whether or not practitioners know what's going on with them. And so I think we need to inform ourselves of the safety issues and the herb-drug interaction potentials there. But also, I think we need to inform ourselves if these things are really efficacious to bring them into our clinical practice, to actually start using them ourselves.
Okay. What conditions can botanical medicines treat?
Well, I would say many conditions. I'm not going to say every condition, obviously, but I think botanicals can treat a huge number of conditions depending on the practitioner's skill level, and that's something in these modules, in this fellowship, that we'll really be working on, is developing skill levels with botanical medicines, with the use of botanical medicines for the practitioners that join us. So, for example, when patients want antibiotics and we as practitioners don't think that's indicated, I think herbal medicines become a very good option there. Obviously, we have a problem with increasing resistance to antibiotics, and so rather than giving someone an antibiotic that you suspect has a viral infection, there's really a good way to go with using botanical medicines that can be safe and efficacious for for upper respiratory tract infections or urinary tract infections or that sort of thing. So that sleep disorders, mood disorders, they're basically, in terms of my own clinical practice of 20 years, there's been very few places that I've found that botanicals can't somehow fill a need or fill a niche.
Great. Dr. Spelman, is safety an issue with botanical medicine?
Well, I do think safety can be an issue. Like with any medicine, of course, safety is our primary concern. So this is why in these modules we'll cover safety and herb-drug interactions of each botanical agent that we discuss so that we know what to expect. But generally speaking, however, what I would say is despite what you read from very biased opinions published in medical journals, I do find that generally speaking herbs are safer than pharmaceuticals. And the stats support that as well. If you look at the number of reports from pharmaceuticals in terms of adverse events, and you look at the number of reports adverse events to botanical agents or herbal medicines, the herbal medicines are a tiny fraction of what's reported for pharmaceuticals.
Great. And are herb and drug interactions a concern for patients using botanical medicines?
Of course, we should diligently review what a patient is on in terms of other medications before prescribing another drug or another herb. But I must say, as a past research scientist, I must say that I look at some of the herb-drug information that's out there, and it's really of surprisingly poor quality. A lot of it's based on theoretical concerns, and in many cases, these theoretical concerns are not proving out. A lot of it is also based on in vitro research that is increasingly being discovered to be inaccurate when things get studied on a human level. Of course, there are legitimate concerns, but they are few and far between in my experience, and also in really looking at the quality of studies in the literature. We're just not seeing the concern borne out in the way that it's being hyped on the web and medical journals. But we'll cover that in each module.
Great. And can you tell us the advantages of botanical medicines?
Well, first and foremost, I have to say that one of the biggest advantages of botanical medicines is that they are generally much less toxic than an isolated chemical. I used to have a teacher in botanical medicine that used to say, the advantage of botanical medicines is that they are naturally dilute and broad spectrum. And then he would go on to say, the disadvantages of botanical medicines is that they are naturally dilute and broad spectrum. So in other words, because you have, in any given plant, you've got anywhere from 3,000 to 5,000 different phytochemicals, plant chemicals. And because of that, not one chemical is concentrated. So from that sense, that's the naturally dilute part that we're talking about here. So they really do tend to be safer. Sure, you can have people vomit or break out in a rash, but we very rarely see serious liver damage or kidney damage. It happens, but it's very, very rare. And interestingly, when it does happen, it gets blown so out of proportion that one or two people had an incident when literally hundreds of thousands of people are using the same thing, that it makes it look like the herb is actually unsafe, which is really sad because then you scare physicians and you scare patients into not wanting to use them. The broad spectrum part of that statement is, again, the fact that there's so many different phytochemicals. And as a result of that, the way I look at it is from a network pharmacology perspective. From a network pharmacology perspective, you're viewing cellular systems as networks. And rather than hitting one node in a network like a pharmaceutical would, by hitting multiple nodes in a network, essentially what you're doing is having a softer impact, if you will, and yet as efficacious often as knocking out one node. So it really is a good way to go. The other advantage, I think, is that, you know, we grew up on a planet, we evolved on a planet full of living beings and plants and animals and bacteria and fungi. And essentially what we're doing when we use botanical medicine is we're harnessing nature. So for those patients that are really into it, what you can do is you can actually have them start growing their own medicines. and that's a real thrill for patients. The first time they grow a plant and then make some medicine out of it and then use that, it's really an eye-opening experience. And I think it really changes their whole demeanor around what medicine is. And I think it really helps them develop a respect for nature, and thus we get more ecological as we go on in treatment. There's also a hypothesis out there that for every viable pharmacological target, there's a natural counterpart in nature, and that would be due to the common ancestries that we share in evolution. So plants make both agonists and antagonists for human physiology, and as a result, I think it makes sense to harness that.
Great. And is there an evidence base for botanical medicine, Dr. Spelman?
There is an evidence base for botanical medicine, and it's growing rapidly, which is really exciting from my end of things. So I spend a lot of time with my head in the literature, but it's really quite exciting to see the evidence base growing. For example, saw palmetto for BPH, or St. John's wort for depression, St. John's wort for mild to moderate depression, I should say. Some of the studies that have been done with St. John's wort by pharmaceutical companies actually look like they were designed to fail. They take recalcitrant patients that are majorly depressed and have basically are non-responsive to any other medication, and they try St. John's wort on them. It doesn't work on them either. So, and then they spend a lot of money publishing and creating a lot of hype saying that St. John's wort doesn't work. But if you look at the meta-analysis, actually St. John's wort works rather nicely, and I've seen it work in numerous clinical situations. Also, echinacea is building a nice database, and although there have been negative studies, the meta-analyses are also showing that echinacea really does shorten a cold or a flu by a couple of days. And I think if it's used right, you can actually shorten it much more than that. So yeah, there is an increasing evidence base building, and it's really exciting to see that happen, and it's very much up and coming.
Great. Well, we are very excited about the upcoming course. Please let us know a little bit of tidbits, some highlights on the Botanical Medicine in Pediatrics course.
Sure. So Dr. Mary Bove is just a fantastic teacher, very, very experienced. I think she's 30 years into her clinical experience, and really is one of the clinicians in the country that I trust the most when it comes to treating children with herbal medicines. She's been doing it for literally decades. She'll also, by the way, do some women's health for us as well next fall, I believe it is, this coming fall, excuse me. And so she's gonna be looking at things like, raising healthy children with herbs, starting from the prenatal environment, and then going into herbs for breastfeeding and infancy, and looking at it from there. And then she'll look at the neuroendocrine, the digestive, and the immune systems and their connection, and how to treat children potentially there as well in regard to optimal growth and development, and microbiota health in the gut. She'll look at gastrointestinal conditions such as colic and constipation and diarrhea, GERD, nausea and vomiting, dysbiosis, leaky gut, etc. That surprisingly, children do actually end up with leaky gut on the kinds of diets that we're feeding them these days. She'll also look at the respiratory system and look at things like asthma and allergies and ear issues and sinusitis and tonsillitis and upper respiratory tract infections, and look at the nervous system and ADHD and stress and children and autistic spectrum disorders and headaches and anxiety and depression and sleep disorders that children might have. And then she'll go on to the dermatological system and look at atopic conditions, seborrhea and diaper rash and warts and basically almost everything that you'd see in a pediatric physician's office, she's just about going to deal with. Oh, and I think she's also going to cover some case studies, which is a great way to, I think, for physicians to learn. She'll actually go through a number of case studies show exactly what she did and allow for question and answer in that.
Absolutely. That sounds very exciting. Thank you so much, Dr. Spelman, for sharing your insight on the fellowship. We really appreciate your time. For those who will be joining us, please give us a call at 561-997-0112 to reserve your seat for the upcoming Botanical Medicines in Pediatrics. Thank you so much, Dr. Spelman.
You're very welcome. Thanks, Lindsay.